I'm Emma Green. I live in Cambridge and I work in medical research, so I run my own consultancy business helping biotechs and tech bio to make new medicines for patients. So I was realising over the summer a couple of years ago that I was getting just more tired than usual. I found it really difficult to get up for work, and it was really, I think, when I was in Edinburgh with a friend going for runs and trying to train, and I almost sort of fainted. I was very dizzy trying to do that. Noticeably, I was much heavier and bleeding. Having to change clothes when I was out for work, it was a bit intrusive, really. It did mean I stopped all exercise. I couldn't really sort of do the things I enjoy doing, and obviously that has a sort of bit of mental strain because you just want to get out there and enjoy sort of being sociable and going out for walks and all the things I normally enjoy doing. So I went to see the GP, and they were the one to first sort of suggest that yes, I was anemic, and actually the reason was probably fibroids causing that. I knew something wasn't right, and once I knew what fibroids were and what I could actually do about it, I was really just trying to look to get treatment so I could get rid of those symptoms. I finally had the hysteroscopy, and sort of 6 months later, my consultant had actually laid out the 3 options of Sonata, embolization and myomectomy, and I had really just done my own research and came back saying I would like the Sonata, please. Being in medical research, I went to look at the clinical trials and some of the clinical data, and it impressed me that people weren't having had good response rates, but also continued to improve over time. Before I knew it, I did actually suddenly get put onto a list with Sonata. I had a local anaesthetic. I opted not to have sedation or general anaesthetic, so I was awake. But there wasn't any pain, it was just sort of discomfort that entire time. And it was great because my consultant sort of was very supportive and checking in with me ever so often and letting me know what was going on as well. I had a whole team of people who were there to look after me, so I think that was quite nice. I was able to go back the same day, but the next day I was already feeling much better. And within a few days, very much just kind of back to normal activities. I had some hiking trips planned in a couple of weeks after and was able to do those. We went on, sort of a 10-mile walk. We went on a 15-mile canoe trip. I wouldn't have been able to do those previously. And it was just great to be able to be back with my friends and doing some of the things I enjoyed. I'm actually now back into exercise, so strangely, I'm going to strength training 3 times a week at 7 in the morning. I also do dance, and I'm still doing some other yoga as well. I'm back to out walking and being able to do a lot more than I guess I could do before. And it's just nice feeling like I've got my life back again.
This testimonial reflects the real-life experience of the patient. In a clinical study, 86% of patients reported an average of 40% reduction in heavy menstrual bleeding at 3 months. Common side effects may include bleeding, spotting, cramping, or discharge. There are potential risks with this treatment such as skin burn and infection. Patients who are pregnant, have a pelvic infection, are known to have gynecologic cancer, or have intratubal implants for sterilization should not have this procedure. Talk to your doctor to see if the Sonata treatment is right for you.